Hello and welcome. My name is Claudia Toribio, and our topic of discussion today are consonant phonemes in the English language. Let's begin by defining them, right? What are consonant phonemes? According to Britannica, a consonant is any speech sound that is characterized by an articulation with a closure or narrowing of the vocal tract such that a complete or partial blockage of the airflow is produced. In other words, consonants are phonemes which require some type of constriction of the airflow in order to modify it. And let's discuss how we classify them. There are three criteria used to describe and classify consonants. There's voicing, place of articulation, and manner of articulation. When discussing any particular consonant, we describe them in this same order. For example, the phoneme th is a voiceless, labiodental fricative. Now, let me make a quick note here. Since we are describing the phonemes in American English specifically, there are some places of articulation and manner in articulation that we will not discuss as they do not occur in this language, all right? Okay, so voicing. Voice in phonetics is the sound that is produced by the vibration of the vocal cords. All vowels are normally voiced, but consonants can be either voiced or voiceless. So in other words, they can either be uttered with or without the vibration of the vocal cords. Some examples of voiced consonants are th and d. Some voiceless consonants would be th and t. Now, place of articulation. Articulation is a configuration of the vocal tract resulting from the positioning of the mobile or active organs of the vocal tract relative to other parts of the vocal tract that may be rigid, also known as passive articulators. This configuration modifies the airstream to produce the sounds of speech. So, in other words, the place of articulation refers to the point in which the active articulator moves or connects or interacts with the passive articulator. Some active articulators are the lips, specifically the lower lip and the tongue, and some those are active. And some passive articulators are the teeth, the hard palate, the soft palate, etc. So depending on place of articulation, consonants or phonemes can be bilabial, labiodental, dental, alveolar, postalveolar, palatal, velar, and glottal. Okay, so as you can see here in this table that was taken from the book Essentials of Linguistics, each place of articulation has an active articulator and a passive articulator that are involved in this modification of the airflow. For bilabial phonemes, we have the lower lip and the upper lip. In labiodental consonants, we have the lower lip and the upper teeth. For dental, also known as interdental, we have the blade of the tongue and the upper teeth. In alveolar consonants, we have the tip of the tongue and the alveolar ridge. In postalveolar phonemes, we have the tongue blade and the postalveolar region. There's also retroflex phonemes, which involve the underside of the tip of the tongue in the postalveolar region. Palatal sounds include the tongue, the front and the back of the tongue against the hard palate. Velar consonants require the back of the tongue to articulate along with the velum. Uvular, pharyngeal, and epiglottal places of articulation do not happen in the English language, so we are not discussing them today. But lastly, we have glottal sounds, which, as you can see here, do not require an active or passive articulator. We are going to discuss that in a minute, how exactly that happens. Okay, so now we have manner of articulation. Consonant phonemes can also be categorized by the manner in which the shaping of the articulators modifies the airflow. We can have stops, fricatives, affricates, approximants, nasal sounds, and also there's tap or flap. And in English, we only have one consonant sound that pertains to this category. Let's define each before we give examples. Stops, with a stop, there's a complete constriction of the airflow followed by its quick release. With fricatives, there is minimal space between the passive and active articulators, causing friction in the passage of air through a narrow constriction. In other words, a bottleneck is created, allowing the air to pass through a small opening. In affricates, there's a quick succession of a stop and a fricative. So the air is stopped, then it is slowly released with friction through a narrow constriction. In approximants, the passive and active articulators are close, but do not touch. There is no contact, and the space between them is wide enough to produce little to no friction of the airflow. Approximants can either be central, which are glides, also known as semivowels, or they can be lateral. In glides or semivowels, the air passes via the middle of the oral cavity, making them very similar to vowel sounds. Hence, semivowels. That's why they're also called semivowels. In lateral approximants, the tongue is approaching the roof of the mouth, and the air passes through the wide openings at both sides of the tongue. Next, we have nasal sounds, where the velum is lowered, causing the air to flow through the nasal passage instead of the oral cavity. Lastly, the flap or tap that we mentioned, it is very similar to stop, but the closure happens so quickly that it is barely noticed. And as I said, there's only one tap that occurs in English. Okay, so now that we have described what is voicing, place of articulation, manner of articulation, here we have the consonant phonemes in the English language. In this chart, we have first the IPA symbols, so the symbols that are used for phonetic transcription. And then we have each phoneme described by voicing, place of articulation, and manner of articulation. And lastly, we have an example for each. So first we have the phoneme P. It is voiceless, bilabial, stop. An example is pat. This is the phoneme B. It is voiced, bilabial, stop, such as in bat. The phoneme T is voiceless, alveolar stop, such as in to. D is the voiced alveolar stop, such as in do. The phoneme K is voiceless, velar stop, such as in Kate. And then the phoneme G is voiced, velar, and it's a stop, such as in gate. I don't know if you just noticed, but we have a trend going here. We have pairs of phonemes which have the same place of articulation, the same manner of articulation, but different phonation. You see? So let's continue. Here we have the phoneme F, which is voiceless, labiodental, and it is a fricative, such as in front. The phoneme F is voiced, labiodental, and it is a fricative, such as in velum. Next, we have the phoneme th, which is voiceless, interdental, and it is a fricative. An example is teeth, teeth. And next, we have the phoneme th, which is voiced, interdental, and it is a fricative, such as in that, that. Okay, moving on, we have the phoneme s, which is voiceless, alveolar, and a fricative, such as in bus. And paired with it, right, we have the phoneme z, which is voiced, alveolar, and a fricative, such as in buzz, buzz. Next, we have the phoneme sh, which is voiceless, post-alveolar, and fricative, such as in rush. Next, we have sh, which is voiced, post-alveolar, and a fricative, such as in vision, vision. Next, we have voiceless glottal fricative, which is the phoneme h, such as in hate, hate. Next, we have ch, ch, which is voiceless, post-alveolar, affricate, such as in church, church. Continuing with j, which is voiced, post-alveolar, affricate. An example is job, job. Next, moving to nasal sounds, we have which is voiced, bilabial, and nasal, such as in mom. Next, we have n, which is voiced, alveolar, and also nasal, such as in none. Our last nasal in English is ng, which is voiced, velar, and nasal, such as in thing, thing. Good. Now we have some phonemes here with, let's say, a special cases of manner of articulation. These are approximants. We have a tap. We have our glottal stop. Okay, so first here we have w, w, which is voiced, bilabial, and it is an approximant. Specifically, it is a glide or semi-vowel. An example is what. Next, we have y, which is voiced, palatal, and also an approximant, specifically a glide or semi-vowel, such as in yesterday, yesterday. Next, we have the phoneme r, which is voiced, alveolar, and an approximant, but in this case, it is a liquid. An example is car. Liquid means that this is a lateral approximant. Next, we have the phoneme the, which is voiced, alveolar, and this is the tap I was talking about earlier. We only have one tap in the English language, and it is often found in when we have the T or T phoneme. For example, in English, usually you would say butter, but in American English, we say butter. So we have that flap or tap there with the T. We use this phoneme, da, okay? Okay, next we have the phoneme O, which is voiced, alveolar, and an approximant, but specifically it is a lateral approximant or liquid. An example is late. And last but not least, we have our glottal stop, which is voiceless. And it's like a quick, not quick, I mean, it is a stop that happens, but here in our glottis. For example, when we pronounce the word button, notice how there's a stop between the first two sounds. That is our glottal stop. All right, so with this, we are done for today. Thank you for your time, and I'm hoping that this information is useful to you. Thank you.